Good morning. Our group, made by Alicia Muñoz, Pablo Mendíbil, Ángel Pérez, María Nocito, Alba Portabella, Enrique de Carlos, Nicolás, and Marta Fuente, intend to explain the sixth of the UN Sustainable Development Goals: clean water and sanitation. Right now, our daily reality when thinking about water can be graphically described as something like this image. However, we ask you to close your eyes and imagine how other people could imagine when they are asked to think about water. Open them. This is how 159 million of people in the world would imagine water, and undoubtedly, this is a huge problem to be solved. To start with a brief introduction, we attached this link to a short video made by the United Nations explaining the main facts about the problem. So, once you've watched it, first of all, we thought, what are the SDGs? And what are they for? Like, what's their goal? Well, the Sustainable Development Goals, also known as the Global Goals, are 17 goals adopted by all United Nations member states in 2015 as a universal call to action to end poverty, protect the planet, and ensure that all people enjoy peace and prosperity by the year 2030. The SDGs are extremely important because they are a powerful advocacy platform to support the implementation and the monitoring of the UN Convention of the Rights of Persons with Disabilities. The 17 SDGs are integrated. That is, they are recognized that action in one area will affect outcomes in others, and that development must balance social, economic, and environmental sustainability. Throughout the pledge to leave no one behind, countries have committed to fast track progress for those furthest behind first. That is why the SDGs are designed to bring the world to several life changing zeros, including zero poverty, zero hunger, AIDS, and discrimination against women and little girls. Everyone is needed to reach these ambitious targets. The creativity, know how, technology, and financial resources from all of society is necessary to achieve the SDGs in every context. In our case, we're going to be focused on the sixth one, this sixth goal, which has the main target of ensuring availability and sustainable management of water and sanitation for all. The question that we made ourselves when we started working on this project and studying the topic was, why does water really matter, and why is its sanitation so important? So after thinking on it, we selected four reasons that reveal why is this a huge problem to be solved. First of all, because the distribution of water and sanitation and how do people get it generates inequality. So, inequality in regions where fresh water must be retrieved from sources outside the home, the burden of fetching and carrying water largely falls on women. The second reason was health, which is one of the major causes of fatalities in children under the age of 5. Also, global warming will make the problem even worse, and the economic costs estimates that cost of sub-Saharan countries are at 4.3% of GDP per year, and in India, the figure is even higher at 6.4%. Since ancient times, there have been changes and improvements regarding the distribution and methods of obtaining these basic goods. From the year 10,000 before Christ to the present day a third urbanization have been achieved, thanks to which all of us have quick and easy access to sanitation and water. However, not all countries have the same fate, and many were stuck in ancient methods. So nowadays, where are we at? Some of the most representative data about the questions are these four facts, which is six, 673 million people still practice open defecation, and the majority of them are actually in Southern Asia. Also, 3 in 10 people lack access to safely managed drinking water services. 785 million people remain without even basic drinking water services. And 1 out of 4 healthcare facilities worldwide lack basic drinking water services. 2.3 billion people lack access to a toilet. 60% of people do not have access to safely managed sanitation. Every 2 minutes, a child dies from a water related disease. 892 million people defecate in the open. And more people have a mobile phone than a toilet. And this is just a crazy fact that we found out. Also, 263 million spend more than 30 minutes per round trip collecting water. 159 million drink water directly from surface sources such as streams or lakes. And finally, 844 million do not have a basic drinking water services. So, these are a couple challenges that have been presented by the UN, which would be the challenges would be unsafe water, inadequate sanitation, and insufficient hygiene, which kills 3.5 million people every year. And the solution would be stop dumping chemicals and waste into environment, invest in sanitation, and raise awareness on best hygiene practices. Another challenge was 80% of wastewater is in the environment, released the environment untreated, degrade the environment, and you destroy nature's ability to provide safe drinking water. The solution would be protect natural resources and avoid water pollution. Last but not least, another challenge was water scarcity, which affects more than 40% of the global population. Finally, the solution was restore ecosystems to secure access to safe water. So, water sanitation are preconditions to life, and we must put a greater focus on these human rights. That is why, during the decade, the international community sets out 3 goals, which are advance sustainable development, second, energize existing programs and projects, and third, inspire action to achieve the 2030 agenda.
They also set some objectives. Most of them are planned for the year 2030, which, in our opinion, is a very ambitious goal. However, it is also proof that changes need to be made soon and fast due to the severity of the situation. These main objectives are: number one is to achieve universal and equitable access to safe and affordable drinking water for all. Number two is to achieve an access to adequate and equitable sanitation and hygiene for all, and end with open defecation, paying special attention to the needs of women and girls and those in vulnerable situations. Number three is to improve water quality by reducing pollution, eliminating dumping, and minimizing release of hazardous chemicals and materials, halving the proportion of untreated wastewater, and substantially increasing recycling and safe reuse globally. Number four, substantially increasing water use efficiency across all sectors and ensure sustainable withdrawals and supply of fresh water to address water scarcity and substantially reduce the number of people suffering from water scarcity. Number 5 is to support and strengthen the participation of local communities in improving water and sanitation management, mainly in those third world countries that don't have as many resources as we do. Number 6 is to protect and restore water-related ecosystems, including mountains, forests, wetlands, rivers, aquifers, and lakes. Number 7 is to expand international cooperation and capacity building support to developing countries in water and sanitation related activities and programs, mainly from countries such as the USA, the UK, or the European Union to those in Africa or South America, which are the countries with the hardest time in terms of water sanitation, including water harvesting, desalination, water efficiency, wastewater treatment, recycling, and reuse technologies. Number 8 is to implement integrated water resources management at all levels, including throughout transboundary cooperation as appropriate. Integrated water resources management is a process which promotes the coordinated development and management of water, land, and related resources in order to maximize the resultant economic and social welfare in an equitable manner without compromising the sustainability of vital ecosystems. The diagram we can see on the slide is one that shows the stages in which integrated water resources management, planning, and implementation go together, and how it's a circle, and how if we do one, a circle will start. 172 countries reported on the implementation of the IWRM. 80% of those had medium-low levels of implementation or even higher percentage. So an acceleration of progress is certainly needed, particularly in the area of sustainable financing and community participation. It's key to ensuring that these IWRM are adapted to local contexts. With respect to the progress on clean water and sanitation, we would like to cover the progress made on clean water and sanitation for the period from 2000 to 2017, which is when we've gotten the data. All taken from the WHO or UNICEF joint monitoring program that produces internationally comparable estimates of progress on drinking water, sanitation, and hygiene. This is called WASH or WASH, and these are responsible for global monitoring on the Sustainable Development Goals target related to WASH. With respect to clean water, there are 3 main points that we want to make. Firstly, the use of safely managed services, which implies improved source located on premises, available when needed, and free from microbiological and priority chemical contamination. From 2000 to 2017, we can see there has been an overall increase in population making use of these, rising from a 61% to a 71%. What we believe to be important, though, is that the least developed countries achieve a high coverage from 25% to 35%. One point worth highlighting is that the reduction of the urban-rural coverage gap has 10 percentage points. While urban coverage increased slightly from 95% to 97%, rural coverage rose from a 69% to an 81%. Secondly, the use of least basic services, defined as drinking water from an improved source, and that the provided collection time is not more than 30 minutes for a round trip. While 1.8 billion people gained access to at least basic services, population lacking basic services decreased from 1.1 billion to 705 million. Lastly, the number of people collecting water directly from surface water sources decreased from 256 million to 144 million. The following graph in slide 25 gives us a breakdown of the increase of over 10 percentage points in the usage of at least basic services in all 8 Sustainable Development Goals or SDGs regions and coverage in 3 regions between 2000 and 2017. We should like to raise 2 points which we consider particularly important. The first one assesses the great increase recorded by sub-Saharan Africa, which since 2000 a quarter of its population has gained access to at least basic water services. On the other hand, though, Oceania has the lowest baseline coverage in 2000 and since, and recorded the smallest increase among regions with less of a 99% coverage. Going deeper on the data mentioned before, we would like to lay stress on the regional drinking water coverage by specifying numbers and differentiating the ladders for drinking water services. From these, we would like to point out that in 2017, 5.3 billion people used safely managed services, 1.4 billion used at least basic services, 206 million people used limited services, and 435 million used unimproved sources. But most importantly, 144 million people still used surface water. Lastly, the map we can see in slide 27 clearly shows the proportion of population that reaches coverage of at least basic drinking water services in 2017. As it is seen, 90% of the world's population used at least basic water services. Moreover, 80 countries had more than a 99% basic water coverage. With respect to sanitation, sanitation in the end refers to public health conditions related to clean drinking water and adequate treatment and disposal of human excreta and sewage. Firstly, between 2000 and 2017, the population using safely managed services increased from a 28% to 45%. Besides, 2.1 billion people gained access to at least basic services, and the population lacking basic services decreased from 2.7 billion to 2 billion. Other interesting data is that the population practicing open defecation halved from 1.3 billion to 673 million. Additionally, rural coverage of safely managed services increased from a 22% to a 43%, and the gap between urban and rural areas decreased from a 14 to a 5 percentage point. In the Sustainable Development Goals regions, 92 countries had estimates for safely managed services, that is 54% of global population, and 3.4 billion people used safely managed services and 2.2 billion used at least basic services. Not only this, but 74% of the world's population, that is 5.5 billion people, used at least basic sanitation services, compared with the 56%, which is 3.4 billion people, in 2000. That's an increase of 19 percentage points. Having said this, 50 countries had achieved over 99% coverage and were therefore classified as nearly universal, compared with just 36 countries in 2000. That is, from our perspective, a huge increase, so we're doing well. However, coverage increased in all SDG regions except Oceania, where it decreased by 7%, and the greatest increase was in Central and Southern America. Eastern and Southern Asia increased coverage by nearly a quarter, which is not bad at all. And finally, population with basic services has doubled from 149 million in 2000 to 314 million in 2017. To round all up, we believe that water is life. We believe that safe water is a basic right to every single human being, and no matter the country or ethnicity, we should give everyone the right to have access to this. Thank you very much.